Today we're unveiling a new series that looks at how the body responds to athletic competition. It's called The Science of Sport, and we're taking you inside the lab with us.
Welcome to The Science of Sport. I'm Dr. Jordan Metzel. In this new series for GMA Health, we're going to look at the science of sport. What goes into sport, what keeps athletes healthy, and how do they stay injury-free and performing well. Today we're at the Hospital for Special Surgery in New York City, and we're here with Dr. Robert Mashi, a physical therapist here at the hospital. Today, we're going to talk about the science of running. Welcome, Rob.
Good morning, thank you.
So tell me about running. How many runners do you see here?
We see quite a few runners, especially with the New York City Marathon. Keeps us quite busy this time of the year, and probably about 80% of my caseload is runners.
And what kind of injuries do runners typically get?
The most common injuries are injuries to the knee, the shin, the foot. So things like patellofemoral pain, IT band syndrome, shin splints. There's very high incidence of injury, especially in runners training for the marathon or longer distance races. And also, unfortunately, a lot of runners don't train to run very well. They don't train their muscles to absorb that sort of impact and tolerate the loads.
I understand one of your patients, Deborah Chin, is here, and Deborah's going to talk about her own marathon experience and what happened to her and her knee. So
yes.
We're going to welcome her.
Hi, Deborah.
Hi.
Good to see you.
Hello, you too. Thank you.
Sure. So I understand you were training for a marathon and you hurt your knee.
I was training and had persistent knee pains, and I never realized that I was running incorrectly.
So Rob, let's have a look at the first test, the step-down test, where you look and see how strong somebody's hips are. Well, Deb, hop up there and give us a demo. Rob, tell us what's happening. So what are you testing here when she does that?
So what we're looking for is her stance leg, her left leg in this case, to look how stable it is. Does her knee wobble? Is she able to keep a nice straight line? Ideally, when you run, you should have a nice straight alignment from your hip through your knee down to your foot. And so we can get a sense of whether she's able to do that.
Is she doing a good job?
She does a good job. She stays nice and straight throughout and controls the motion and lowers herself very slowly. We can compare this to some of the video we took earlier when she was injured, and you can see the difference.
What's the difference?
In her earlier video, you can see that her knee drops to the inside and she comes out of that nice straight alignment. And studies have shown us that in runners that do that, they're more susceptible to injury.
So she was wobbly.
Correct.
And it sounds like when she was wobbly, her hip was wobbly and she couldn't control herself.
Exactly.
And then she got hurt.
Yes.
So now she's stronger and she's in good shape.
She looks good.
Let's see what it looks like on the treadmill.
Very good.
What is this program called and how does it work?
Good. This is a 2D, two-dimensional video software analysis. And so we use a software program called Dartfish that allows us to slow down and capture video clips and pictures throughout her running cycle. And we can actually use it to take measurements. It has measurement tools so we can measure angles and distances and things like that. And that gives us some objective numbers that we can look at, in this instance, compare her from her injured state to her non-injured state.
Deb had patellofemoral knee pain. What is that?
Well, it's an irritation of the cartilage under the patella, and it's very common in runners. It's the most common running injury there is. And what happens is you get pain behind your patella. And generally it's caused by lack of control of the hip. So part of her physical therapy included strengthening her gluteus medius and gluteus maximus, her hip muscles, to really control her limb rotation when she runs.
What about the way people run, the cadence, and how quickly they run?
Right, so cadence is an important issue. Cadence has to do with the amount of steps you take per minute. A common injury that we see is related to overstriding, where people take too big a stride, and that's been shown in studies to increase loading of the knee and the shin.
And how do you know if somebody's overstriding?
Well, with this software we can actually detect, and we can see where their foot strikes the ground, if it's underneath their body or if it's too far out in front.
And if your cadence is quicker, what happens then?
You decrease your loading. So it's less impact loading every time you hit the ground, less harmful loads going through your joints, your soft tissue, your muscles and tendons.
Great, so it's almost like you're spending less time on the ground if you're running quicker.
Exactly.
So Polly DeMille, you're an exercise physiologist here at the hospital. What does exercise physiology testing mean?
What is exercise physiology testing? We're testing here with Deborah. You can test a lot of things, but with Deborah we're testing her maximum ability to use oxygen and the point at which lactate levels start to rise in her blood as she's running, and also how efficient she is running, how much oxygen she uses at a given pace.
Deborah's wearing this kind of weird looking contraption. Describe what she's got on.
Well, she's got a mouthpiece which she's inhaling and exhaling through the mouthpiece, and every bit of her exhaled air is coming into our machine for analysis. So we're measuring, we know that the air she's breathing in is 21% oxygen, and we can measure what she exhales, so we know exactly how much oxygen her body's using. We're also measuring carbon dioxide. We're measuring how much air she's breathing per minute and how much in each breath. So we get breath by breath analysis of exactly what's going on metabolically.
Now, Polly, how much of this is genetic and how much of this is trainable?
Well, maximum VO2 is largely genetic, so it helps to have the right parents. You can increase it to a certain extent with training, but it's largely genetically determined. Your lactate threshold is actually quite trainable, and people who haven't trained at all usually start accumulating lactate in their blood at about 45% of their maximum level of effort. And with training, you can get that close to 85 or 90% of your max.
Polly, thanks for that great information. And thank you for joining us for the Science of Sport. I'm Dr. Jordan Metzel. I'll see you next time.